Welcome to this online presentation which replaces the Year 8 Parents' Evening normally held in the Academy Hall. The information discussed will be given by myself, Frances Dawes, and my colleague Lorraine Mackay, Assistant Head. If at the end of the presentation you have any concerns or questions, please could you email them to me at the email address shown. This slide indicates the areas that the presentation will cover. Our main priority for this academic year has been to get the students back into learning. There is no denying the disruption to learning and normal experiences in the school year that your child had since March. As educators, we are keenly aware that students in Year 8 missed opportunities to consolidate their Year 7 experience. The work set during lockdown was carefully chosen to cover missed content, but we know that students will have approached this work differently. As soon as it became evident that your child would not be returning to school until September, we began to plan for a Year 8 recovery curriculum. The recovery curriculum at Churchill is in place now and covers the academic and pastoral planning aimed at supporting your child with issues and anxieties, helping them to settle back into routines and to reframe their behaviours in school so that we all remain safe and enjoy being back in the classroom. For this reason, all of our staff have completed additional CPD on bereavement, trauma, grief and anxiety. Staff have also refreshed their safeguarding training. At the end of Term 1, we are now reflecting upon how our pastoral team are effectively supporting students. We know that the introduction of Lancaster House has meant that there are fewer students in each tutor group, and that the new timings of the day have enabled us to reshape the pastoral programme. We feel confident now that the 20 minutes with tutors first thing in the morning can be focused on the key messages for the day and give tutors an opportunity to check on the well-being of their tutees and to see who might need that extra bit of support. This tutor time sets a very positive tone for the day. The recovery curriculum in the classroom has been implemented so that in this term teachers have focused on looking at what gaps in learning exist, and with each class they have looked at their plans for the year and identified what must be addressed immediately because it underpins what comes next and what can be covered later. The recovery curriculum does not merely mean repeating or reteaching material that was set during lockdown. Many of our Year 8 students approached their lockdown work diligently and productively, and we know the important role that you as parents played in this, and we thank you for that. Where students do need to catch up with their peers, for whatever reason, this piece of work will be delivered separately and will not prevent others in the class from progressing. As we move forward into Term 2, we are very much hoping to be able to focus on strengthening the experiences offered to Year 8. We have a new student leadership programme planned by Assistant Head Mr Davis, and he will be sharing more about that next term. We will be continuing to focus upon embedding our house structure. We are also working hard to respond to some thornier issues in society which arose during the past 6 months, and to work with our students to promote anti-racism and equality in the Academy, as well as promoting care for our community and the environment. Year 8 have settled well. They have welcomed Year 7 in a supportive manner, and they are positive and focused in class. On this slide I have outlined the key dates affecting parents of Year 8 this year. Please note the internal exams week. In Year 8 the majority of exams will be held in the classroom, and as yet we have no plans to bring the whole year group together in the sports hall. We will keep you posted on this. In May you will note that there is a Year 8 Parents' Evening. Again, we are unsure of the format of this and will keep you informed. I've popped this slide in as a reminder to you of all of the subjects that make up your child's curriculum. Currently the students are learning in mixed ability learning groups. We had planned to introduce more setting and changes of students in groups during the year, however due to COVID we are currently unable to do so. Should you wish to read more information about exactly what your child is studying in each of the subjects, you can find the curriculum information booklet for Year 8 on our website. You simply go to the Information tab on the website and then select Curriculum and scroll down to the bottom of the page where you will find all of the information booklets for each year group, and Year 8 is towards the bottom. Within the booklet you can find details of the content, the aims and the coverage, approaches and assessments used in each subject area. For further information there's an indication of which teacher can be contacted. It may seem that we are hard to contact, but we are working really hard to keep in touch with you and to not seem distant in these difficult times. Please contact your child's tutor with any concerns. You can do that through Insight or by email. You can also just pick the phone up and leave a message, and hopefully we will be able to get back to you within 2 working days. If you have any problems with using Insight, please use the email address on this slide to report any technical problems and to get the help that you need. All of our homework and lockdown work is set now in Google Classroom. We are becoming much better at this medium. You should have had an invite as a classroom guardian. This will enable you to check in, keep up to date with what work has been set, see the work that your child has uploaded, and help your child let us know if there are any issues or concerns. As I said, we are getting much better at this medium, supported brilliantly by Mr. Hart, who has become an accredited Google trainer during lockdown. All of our healthcare plans were updated during lockdown and we think that we're up to date. However, if you know that your child needs a new healthcare plan or anything has changed, please contact Matron Joy van Weyenberg on the email address on the slide. I'm now going to hand over to Lorraine Mackay, Assistant Head. Thank you.
Hello everybody, my name is Lorraine Mackay and I'm the Director of Student Services here at Churchill Academy. Student Services is an area within the heart of the Academy that supports our students when they have situations that need specialist support. For example, sometimes some of our students have mental health issues that they want to come and talk to specialised teachers about. They would also possibly want to come and talk to somebody if they've got academic concerns that are paramount at the present moment in time. Some students suffer from anxiety. Other students may have trauma going on in their life. They may have bereavement and grief issues that they want to talk to students about. Some of the students have physical issues that they need some extra support with as well. So those students may not necessarily be here for a long period of time. They may only be here for a short period of time. So if you find over the next couple of years that your child is distressed and needing additional pastoral support, Student Services is the place that you can obtain that specialist support from. On this slide in front of you, I have put in a few bullet points, healthy child mental health, and that's what we're aiming for all of our students. But the reality of the world that we live in is that that's not always obtainable all of the time. So we're here to support you as and when you need that support. One of the areas that we support our students in is emotional disorders. And that's not to say that we are mental health experts, but there are some of us who have had training in mental health. It's called first aid mental health training given to educationalists. And it gives us a better understanding with regards to what are ordinary emotional issues that an ordinary teenager would go through, as opposed to other emotional issues that might cause us more concern, and they'll need some additional support in the guise of counselling, or maybe we might help you with a CAMS referral or ask you to go to your GP to get some additional support where that's concerned. We have a wellbeing team here at Churchill Academy which comprises two people, Moya McNeil and Rachel Millett, and both those ladies have a caseload of students who they see on a termly basis. So there is a waiting list for both of these individuals, and if you feel that that might be a useful support mechanism for you, then you can have a conversation with your child's tutor, who will have a conversation with their head of house to see whether or not a referral is appropriate for that particular individual. What we don't do is provide two forms of counselling for students at the academy if they are already receiving external counselling. So that can cause a few concerns and a few issues if two different counsellors are talking to your child. So it's either counselling they're receiving in school or support they're receiving externally from school. It's really important as parents and carers to distinguish the difference between mental health issues that children might be displaying and actually normal adolescence. So adolescents will start to push the boundaries. Adolescents will test our patience on occasions. They will change dramatically from year 8, 9 and 10. And they will be challenging our authority on occasions. But that doesn't mean to say that they're displaying abnormal well-being. So it's really important not to over-assume that when your child becomes increasingly challenging that there must be something wrong with them. So this slide just basically indicates very succinctly the type of things that will be happening while your child is maturing during adolescence, and it's just normal adolescence and nothing for us to necessarily overly concern ourselves about. The ways that adolescents cope with this change that's taking place is to often be quite negative about themselves and about their peers and about their everyday schooling and what's happening at home. So we're used to that level of negativity and that roller coaster of a ride of emotions, that they could be feeling really happy one day and the next day they're very upset about something, and projecting that frustration and that anger onto their parents and onto their peers very often. So they're often confused with emotions and how they're feeling at that present moment in time, and it's quite normal for them to be isolating themselves away from their family on occasions and experimenting with the way that they're looking and different friendship groups. So all of that are normal adolescence. So it's really important that parents, particularly if it's your first child going through that, feel that they can pick up the telephone and have a conversation with some of the pastoral staff, your head of house, or anybody in the student services team that you feel comfortable talking to, because it is something that we have many years of experience of. So sometimes it's just a good idea to pick up the telephone and have that dialogue with somebody to put your mind at rest that maybe the way that they're behaving at home isn't the way that they're behaving at school, and sometimes it's vice versa. Sometimes they're acting up at school and they are actually behaving at home. So by all means feel free to have that confidential conversation with any one of us at any point in time. I think as educationalists we can't emphasise enough the importance of sleep with children, and that there is an increasing concern about the amount of time that children are spending on their phones and spending on electronics generally, and their obsession with social media, and how that is having a huge impact on the amount of sleep that children are actually receiving. And it's very true to say that poor sleep patterns and not obtaining enough sleep is really detrimental to their well-being. This isn't simply a case of them being overtired in school and not able to concentrate. It's a build-up effect over many, many months and weeks of not sleeping properly and being in poor sleeping patterns. And that very often what we see displayed at school, which is attributed to mental health concerns, is nothing more than children not obtaining enough sleep where that's concerned. So it is true to say that it is a challenge with a teenager to put bedtimes in place and allow them the opportunity to play on electronics and to have some downtime. But if your child is allowed their phone in their bedroom, is allowed ICT and computers and things like that in their bedroom, then you know very well that they are likely to be up in the middle of the night looking at things that possibly they shouldn't be looking at, and their sleep pattern is being disturbed by other children that are possibly trying to get into trouble with them as well for being on these things when they shouldn't be. That goes without saying. That's a safeguarding concern at the same time, because you need to be monitoring who they're actually speaking to when they're on social media, on their telephone. So I've just put some of the symptoms of a lack of REM sleep, rapid eye movement sleep, which is the most important sleep that we can try and ensure that our children get. And these are some of the symptoms of prolonged rapid eye movement sleep deprivation. So it's really important that parents have that dialogue with their particular students, with their children, because sometimes it's nothing to do with mental health issues. It is purely a lack of sleep that your child is displaying. This slide is about having academic resilience. It's absolutely true to say that as children go through secondary school, it is an emotional roller coaster of falling in and out of love with different friendship groups and different subjects, and having challenges from teachers and challenges from their peers as well at the same time. And it's not always easy when our children don't want to go to school and that you think that they are avoiding issues in school. So it's what we can do in school and what you can do as their parents to actually try and get a support network to make sure that your child is prepared for what's going to happen to them for the 5 years in main school that they're going to be. That they may have blips in their behaviour on occasions, and it will be normal naughty behaviour. It will be normal concerns that they're displaying. It will be a normal resistance to not maybe wanting to go into school, a normal level of inactivity when you've gone from a child who wanted to get involved in all sorts of hobbies outside of school and activities to a surly 14-year-old who may not want to do anything outside of school. So it is about what we can do to encourage them to do in school, and what you as parents can do to encourage them with other individuals as well, not just yourselves. So other friends of the family or other key people in the local environment that can support you with that. And it's accepting that there will be hard times on occasions, and that you will find subjects difficult on occasions. You will be feeling overloaded with homework on occasions, and it's actually how we can help you with that situation and how they can help themselves in that situation, building up resilience that is going to help them in the world of work eventually when they get out there. So as a school, we are absolutely wanting to work in partnership with the parents and the carers. It can be an interesting journey on occasions, and it's about being open and frank and transparent with each other about what we are both seeing maybe at school and what you're seeing at home, concerns that you have that we can put your mind at rest to with regards to that, and the journey that we're going on. So they start as fresh-faced young people who love everything about secondary school, and then they'll go through different feelings as they travel through that 5-year journey. And then what we want at the end of it are well-rounded young people who accept that this journey can be bumpy on occasions, and that they've had some trusting adult relationships which have been really productive in school, that they feel accomplished, that they've done the best that they can actually do, that they're busy people with a sense of purpose and that they've got some ambition in the future and they've got some desire to go on and work and be fruitful people in the community. So there are plenty of opportunities for you to talk to people in the academy. Obviously the tutor, hopefully your child will have a tutor that will be here for a significant period of time, so you can build up that relationship with the tutor. And we're fully aware of the fact that most of our parents are working parents, and that's why we encourage you to get in contact with us via email, and that it's a situation where you can ask to speak to somebody in student services if you've got some concerns. Obviously at the present moment in time with COVID-19 it's a bit more challenging to have face-to-face conversations with parents, and that's why telephone conversations are frequently happening at the present moment in time. Also Zoom calls that we might have with parents if they've got concerns as well. So I wish you the best of luck with bringing your children up over the next few years, but by all means feel that you can obtain the support and have that conversation with people in student services should you feel the need to in the near future. Thank you.